Welcome, everyone. Thanks for joining us for today's webinar on leadership skills to improve health and safety. My name is Katie Dively, and I work for the Center for Health and Safety Culture at the Western Transportation Institute of Montana State University. And I'm a research scientist at the center. I'm happy to have everyone with us today. Please take note that we're recording this webinar. So as soon as we have it available, we will be placing that on our website for you to view later, or send it to your colleagues, or pass it over to those who might have been interested in joining but weren't able to be with us live. So I don't anticipate that this webinar will take a full hour. However, I really do want your engagement. I'll be looking for some feedback on a couple of questions that I'll be asking, and asking you to respond through the chat window. So I hope that you do take part in that, because I think we can all learn from everybody's wisdom here. So a little bit more about the Center for Health and Safety Culture here. We're an interdisciplinary center serving communities and organizations through research, training, and guidance to cultivate healthy and safe cultures. And my main role as a research scientist is to get that research out into the hands of the people who need it, people like you, people that are doing the work within their communities or within their organizations. A couple of the core issues that we work on at the center are traffic safety, substance misuse, domestic violence, and child well-being. And while we work on a variety of different topic areas, beyond these are really our main focus in the efforts of our work to improve health and safety. At the center, in order to improve health and safety, we use the positive culture framework as a way to organize our work. And this will give us some context for today. So I want to go through this very briefly so that you can see where the skill of leadership fits in. So as you can see at the far right, we're working to improve health and safety. That's our ultimate goal. And take note that this is an upward pointing arrow. So we're using an appreciative frame where we're focusing in on what behaviors we want to grow to improve health and safety. And we do that by improving cultural factors, or those values, attitudes, and beliefs associated with certain behaviors. How do we do that? Well, if you shift your eyes to the left a little bit, you'll see that circular process. And it's outlined in blue from 1 to 7. So this is a process. I'm not going to go into it today, but know that there is more information on this process for implementing the framework, either on our website or in previous webinars that we've done as well. So you can certainly take a look at those. But that is the process that we have here outlined in blue from step 1 all the way through step 7. You'll notice these 3 words around that process, and these are the 3 skills that we believe are really important in the outcomes of improving health and safety. So focusing in on leadership is definitely what we're going to do today, so I'll get back to that one. We also want to build skills in communication. To engage in this process or any effort to improve health and safety, we need to communicate. So we want to be really intentional with our communication and build our skills there. We also seek to grow our integration skills. So we know that integrating our strategies is important, and you might notice I said strategies, plural, that's right. We know that there's never one strategy to improve health and safety or to shift a behavior that we're working on. It takes multiple strategies to do this. So integration is really about how we're managing that portfolio of strategies. We're asking ourselves, do we have duplication? What are we missing? How effective are our strategies? So that's the work of integration. And then where do we do the work is right here, outlined in purple. This is the social ecological model. These are the layers of social influence in our community. So we want to work across these different layers of the social ecology, but I'll get into that a little bit more specifically when we start talking about leadership here. So again, these are the 3 skills that we really believe impact your efforts in improving health and safety. So now let's focus in on this one skill that we're going to talk about specifically today, and that's the skill of leadership. So a question for us to ponder today, what are the critical leadership skills to grow a positive culture to improve health and safety? So beyond just leadership skills, what are the leadership skills necessary to improve health and safety? Okay. So first of all, I want us to sit for a second and think about a leader that inspires you. So I'm going to give you just about a minute to do this. Think about someone that inspires you. Give a name to this person. This should be a real person. And it can be somebody that you've never met. That's okay. It could be somebody from your, that lived before us. That's fine. It could be a supervisor or a colleague. But think about someone specific, a leader that inspires you. I'm going to give us about 30 more seconds. Again, think about a leader that inspires you. Identify them by name, because I'm going to have you think about them a little bit more deeply in the next minute or so. Okay, so hopefully we have that leader in mind. Now I want you to identify what are the qualities or the characteristics of this person that you admire. Okay, so think about some of their qualities. They inspire you for a reason. Let's think about some of those qualities or characteristics that you admire about them. So if you think for just a minute or so, think of these qualities, but then when you have it, please write those qualities or those characteristics in the chat window. So that chat window should be probably on your right-hand side of the screen. I'd love to see what you have to offer here. What are some of those leadership characteristics or qualities that you identified that you like about that person who inspires you? Good, excellent. I love what's coming in. Great. Keep them coming. We've got that they're humble, they see new visions, they're honest, empathetic, they're inquisitive, they're an encourager, they lead by example, they're transparent, honest, they know when to push when necessary, perhaps they're intelligent, proactive, patient. These are wonderful. They're calm in the face of adversity. They're encouraging. They're a good communicator, approachable, credible, wonderful. These are great qualities and characteristics of people that we admire. So now, some of these are hard to see. Some of them we think about, but we haven't actually described what they look like yet. So what I'd like you to do now is I would like you to identify what are the behaviors that these people do to animate that quality. So for instance, if they're credible, what are they doing to portray that they're credible? Or if they're honest, what are they doing? What is that act that they're engaged in that portrays or animates that quality that we've just talked about? So again, go ahead now and write that in your chat window. Great. An open door policy, admitting when you're wrong, checking in with staff, asking for feedback, seeking for more information, engage in the genuine conversations. They're friendly. They don't make rash decisions. These are awesome, guys. They're always available. They're asking for input. They're listening. They're level-headed, open to new conversations. Keep them coming. These are great. These, again, are the actions that animate the qualities or the characteristics of the leaders that inspire us. Consistency in their daily habits, strength emotionally. They set an example. Yeah, they remember past conversations. These are great. So this is interesting. As we think about these actions that these leaders are taking, this is what leadership really is. Leadership is a collection of the actions that we take, right? It's a set of behaviors that leaders have. Prevention is absolutely an act of leadership, wouldn't you think? We're leading people towards healthier and safer behaviors. We're all leaders. So our actions, the actions that we take, are really critical in our effort. So again, back to this original question that I had posed. So what are those leadership skills or actions necessary to grow a positive culture to improve health and safety? So we've identified some broad, general actions that leaders take that we admire, but now specifically, what are those necessary to grow a positive culture to improve health and safety? So we start off with that ability to raise concern and hope. So yes, we need to raise concern so that there's engagement in our community or in our organization, but we also need to raise hope so people understand that there's a solution. We want to lead across the social ecology, around these different social layers of influence within our community or within our organization. And also the third act of leadership is that ability to cultivate transformation. Humiliation, shame, and guilt and angst are not the primary engines of change. Ironically, such experiences can even immobilize the person, rendering change even more remote. We're looking for change, aren't we? Like all of us in our work are looking for change. And we see this as not the way to do it. We want to be really intentional about how we create this sense of concern that's before us. So this is much different than creating a sense of shame or creating a sense of fear. This is about acknowledging that there are serious risks or consequences of engaging in certain behaviors. So when we do this, when we raise concern, we get engagement. We get other people that are motivated to act. But if they're not concerned, why would they engage? So building that level of concern is really important, but I want to be very clear that this is different than creating a sense of fear in someone, which can immobilize them, or that they could react without even thinking. We want individuals to be thinking through the decisions that they're making. And don't get me wrong, there's a time and a place for fear. We all need that for survival, right? We need that fear when we're standing in the middle of a road and there's a car barreling after us. We need that. But what we're talking about today, these behaviors that lead to improved health and safety, that's not where we want to create fear. We're talking about those types of decisions that people are thinking about before we act. It's not that reflexive behavior. These are intentional decisions that we're working on. We know that fear appeals can have unintended adverse outcomes. They can label and stigmatize groups. They can expand social gaps in our communities or within our organizations. And they can promote poor health as a value. They can shut down constructive conversation. We don't want that. We want to build concern, build bridges, not fear. So how do we do that? So that's fine. Okay, we want to build concern, but how do we do that? Well, we can share facts and figures, right? We have data sets. We can talk to maybe the law enforcement, see what their data sets are revealing. Talk to hospitals, see what their data sets are telling us about the concern relating to the issue that we're working on. We could show gaps between actual norms in the community and perceived norms. So we'd show what's actually happening based on the data that we've received and what people believe most others are doing, because that builds a sense of concern. We can also listen to people's personal stories from their experiences. All of these ideas help us share concern in our community and do so in a way that doesn't make people so scared that they're immobile. Raising concern, like I mentioned earlier, isn't enough by itself. This is where hope comes in. Remember, we're raising concern and hope. Hope is the perceived capability to derive pathways to desired goals and motivate oneself to use those pathways. Hope isn't this happy-go-lucky kind of notion. There's a lot of research behind hope. In essence, what this is saying is that if I have hope, I have the willingness and the path forward. Now, if you flip this around, if we don't have the will or the path forward, we don't act. We can get stuck, right? So we need both of these. We need that willingness, that motivation to move forward, but we also need to see that path forward, and that's where hope is. So research would show that there's there is a lot of improvements when we have hope, and what we've seen in the research is that there's improved academic or athletic performance, engagement in individual primary or secondary prevention activities. That's great for the work that we're in, and improved physical and mental health. All of these really important in the work that we do. So how do we do this? How do we get to a place where we can raise hope? Well, I'd go back to the data again. We can again look to the data and start to share what are the positive facts about the culture that we're in. What are those protective beliefs and behaviors that are common in our community that we can start to express to grow that level of hope? We can refocus our efforts from being focused in on that individual level or that group of individuals to now focusing in on systems. And we'll talk a little bit more about this when we talk about the social ecology. Giving that path forward or trying to get at that path forward can really be about sharing strategies that work. We can talk about evidence-based practices that we could follow. We could talk about solutions that exist in our community. We could talk about this active engagement of people or a team that you have working together to approach the issue. All of those are allowing us to build hope, to either motivate oneself to act or even share that path forward that we need. So we've talked about raising concern and hope now, and now I want to get to the second act of leadership, which is leading across the social ecology. The social ecology it describes the different layers of social influence in our community. It shows us that individuals, or our focus audience, and I'll call it a focus audience rather than calling it maybe a target population or a target audience. So our focus audience doesn't develop their beliefs or their behaviors in isolation. They're influenced by the values, the attitudes, the beliefs, and the behaviors of these other levels. So for example, a teenager, which we would say is an individual and a part of a group of individuals, is influenced by their family and their peers. They're influenced by the school rules and policies of that school or the organization that they belong to. They're impacted by community laws and how those laws are enforced. So it becomes really important that we start to think about how it becomes really important to think about what we're doing to grow positive actions in each of these levels because they influence one another. Note that it can work the other way too. We can, as individuals, start to influence these other layers. So it works both ways. When we start to see change in one of these areas, it starts to ripple out and go into that next level. To have a cultural, a sustained approach, we really want to engage in strategies across these layers. So not only are we asking ourselves, what do we want to shift with the individuals that we're working with or within our focus population, but what do we want to grow among families or parents? What are the behaviors we want to grow within schools or organizations or law enforcement? Or maybe what policies, what protective policies do we want to create in the community as a whole? So implementing prevention strategies across these social layers becomes critical so their efforts can be sustained. And this is a shift in thinking. We're not just focused in on those individuals anymore. We're focused in on the systems around them. What are the strategies that we need within these systems to support change at that individual level? So this is a social ecology in a community, but I also want to acknowledge that there are social ecologies within organizations as well. So you can see this diagram also looks a bit different. That was intentional because you will see different variations of the diagrams of the social ecology. And while they do have a few different designs, they do reflect the same thing, that there's different layers of influence surrounding individuals. So this is my organizational social ecology. I thought this might be valuable for you to take a look at. So I'm right here in the center. And I work for the Center for Health and Safety Culture, and our director is Nick Ward. So of course, the Center for Health and Safety Culture plays a role in what I do and what I believe and so forth. But the Center for Health and Safety Culture is also located within the Western Transportation Institute. And so Nick Ward in the center, we report up through the director of the Western Transportation Institute, who's Steve Elbert. So of course, the Western Transportation Institute impacts our beliefs and our behaviors at the center. And of course, all of us are at the Western Transportation Institute. We also are within this College of Engineering. And so of course there's policies and procedures and things that we follow within the College of Engineering and Dr. Gunnick, and who's the dean of that college. But of course, we all also work within Montana State University, and we have a president, President Corzato, that absolutely plays a role in all of these different levels as well. So hopefully by me sort of outlining what my social ecology, you can start to break down what that might look like in your organizations as well. And don't forget, remember, while these all have organizations on what I do, I can also have organizations within my center, within these larger spheres as well. So what does this look like in action? When we're leading across the social ecology, what does that look like? Well, this is focusing in on that ecological approach, right? We're starting to look at the community as a series of systems interacting and connecting with one another. We're kind of shifting our focus from just a group of individuals that we might need to change the behavior of, but wow, what can I grow? What are those protective attitudes and beliefs that I can grow across these social ecological layers to reinforce that behavior with young people or whoever our focus population is? It's also about seeing that attitudes, beliefs, and behaviors of others impact those engaged in the risky behavior that we might be trying to prevent. So in a work site, we might have asked ourselves the question in the past, maybe, how do I get frontline staff to adopt a new behavior? Well, now we're starting to transition that. When we think about the social ecology, the question now becomes, what are the actions that I want to grow across the social ecology of this organization to support adoption of this behavior? So you can see that shift in language. We're not only talking about maybe the frontline staff, but also what are those behaviors we want to grow in these other environments of influence within the organization to support the adoption of that behavior with frontline staff. At a community level, this might look like, for underage drinking specifically, this might look like where previously we were asking ourselves, how do I get youth not to drink, right? We're focusing in on the individuals, which are the youth. To now, what are the actions I want to grow across the social ecology of my community to reduce underage drinking? Again, this is a shift in our language, right, where we're starting to see this connection between the different spheres of influence in our community. And we're starting to understand, wow, they influence youth. So I better start looking at what actions I want to grow across the social ecology to really be effective here. And I want to give you an example of what that might look like. Because we're not asking for the same behavior at each of these levels. No, definitely not. So for underage drinking, just for an example, we still want to work with individuals, without a doubt. And this looks like maybe education. We could have curriculum here where we're talking about maybe the risks associated with engaging or not engaging in a particular behavior. Or we might talk about consequences as a result of engaging in the behavior. We might teach refusal skills. With families, we want families to have rules about not using alcohol, to have curfews for their children, and maybe perhaps have a rule about checking in when they're out. So family rules become a very important factor in whether or not youth drink underage. And within schools and work sites, this is where policies come into place. For example, a school policy for underage drinking might be, that there's an activities participation policy. If somebody is caught drinking alcohol, they could be excluded from some activities. In a work site, this might look like, alcohol in corporate events. How are we modeling behavior? Do we have restrictions at some of our corporate events for alcohol use? Maybe we give drink tickets or something like that. At a community level, this can look like policy and enforcement of a policy. So we could have something like a social host law where we're prohibiting the provision of alcohol to minors. So that's a social host law. Or we might have festivals where we are actively engaged in underage drinking prevention with the individuals who are hosting a festival if they're providing alcohol, right? Are they checking IDs? Are they ensuring that youth do not have access to alcohol? And of course, with law enforcement, we want to promote strong and consistent enforcement of underage drinking laws. So you can see how these kind of play out across a social ecology, but again, they're different. We're asking for a different behavior in each of these groups, all of which relate to underage drinking in this scenario. So if we go back to our 3 acts of leadership, now I want to focus in on the third, which is cultivating transformation. So we are familiar with that idea that a caterpillar transforms into a butterfly. We know that it's one directional. This butterfly can never go back into being a caterpillar. It's a different being with new actions. But I would also have you take note that there was a cocoon-like phase in the middle, a chrysalis-like stage. It didn't happen overnight. Now with humans, it's not as clear. Of course, we don't wake up and look different. We have transformation within our minds where we see the world differently. We act different. And there's likely a transition stage in the middle of us as well. This phase can be really tough, actually can be incredibly tough, and it takes time. We know if we've ever kind of transformed our thinking on something that there can be struggles here. And I think a great example, when I start to think back about public health and a clear example of transformation, I think we can look to tobacco use and smoking. You know, these clean indoor air acts that we have today didn't happen overnight. They took decades. And you better believe it wasn't easy to get to the point that we're at today. Many of you might have worked in the field or still work in the field. But we did transform. We're never going back to where we were. We have different beliefs now. We have different actions now. When we cultivate transformation like this, we sustain our impacts because we are fundamentally different at the end. So what does it look like when we're doing it? Because transformation we can't see. So what does it look like? Well, it's about planting seeds in the minds of others. We can't transform anybody but ourselves, but we can plant seeds that makes it more likely in the minds of others. We can start to work to shift people's mental models, how they're thinking, including maybe clearing up some misperceptions that folks might have. Again, looking at that shift where we're not focusing in only on a group of individuals, but that systems level change across the social ecology. That's community transformation. When we can get all of those systems working together, that's what takes us to that level of transformation. And we know that transformation is sustainable. That's what keeps our efforts going. So how do we do it? Well, we ask questions. When we start to think about planting the seeds for cultivation within others, we can do that by asking questions. Asking powerful, kind of big questions often gets people thinking. Are we thinking long term? Are we just setting our goals for this year and next year? Or are we really thinking long term? What do we want? And then setting up strategies and specific milestones to reach that. Are we using a cultural perspective? Again, rather than that individual, are we looking across the social ecology to truly transform this issue? I mentioned asking questions. I think asking questions is one of the most powerful things that we can do in our community to create transformation. And this is a great resource that I go to a lot. It's called The Art of Powerful Questions, written by Eric Vogt, Juanita Brown, and David Isaacs. You might be familiar with this document if you have ever engaged in a World Cafe process. But they have great questions that help us motivate people. They encourage conversations. They motivate people to get to a certain understanding together and seek what their goals are. So the Art of Powerful Questions, I'd encourage you, you can Google it and it comes up and you can run it off because it's a PDF, but just a great resource if you're looking for planting those seeds of transformation within others. The Art of Powerful Questions. So as I come back to this question that I had us think about early on, what are the leadership skills, or I might say acts, that are necessary to grow a positive culture to improve health and safety? So we've illustrated that it's about raising concern and hope, that we raise concern, and that's quite different than creating fear in someone. So we raise concern to get them engaged, but we also have to provide that path forward, that hope. We seek to lead across the social ecology, or those layers of social influence within our community, understanding that individuals don't operate in isolation, that they're influenced and they're impacted by the different levels of the social environments around them, whether that might be a community, whether that might be an organization, that really if we want this transformation, if we want this change to be sustained, we've got to think about what we want to grow across the social ecology to be effective. And third, cultivating transformation. What are we doing to shift the mental models of people? What are we doing to ask important questions to get people thinking differently about this issue, and knowing that that's what sustains our approaches long term? What I'd like now is just to ask a few reflection questions, and these are for you to simply reflect on. I think they're good. Maybe possibly write them down if you can, because they're good application of what we just learned. So you can ask yourself, in terms of raising concern and hope, how do I embrace a positive, hopeful approach to my work and, to enhance my leadership effectiveness? Do I embrace a positive or a hopeful approach, and how do I do that? How do I lead efforts across the social ecology, whether that be in my organization or within my community, to improve health and safety? Or am I only focused in on the individuals? So how do I lead those efforts across the social ecology? And the third question I'd like you to think about, maybe write down, is how am I cultivating transformation to sustain our work? How am I cultivating transformation? How am I planting those seeds? Am I asking important questions to sustain improved health and safety? So 3 reflection questions that I'd love for you to take a minute to think about when we get off of this webinar, because they really help us understand how you're engaged in enhancing your acts of leadership in terms of improving health and safety. Before I get to questions about the webinar, I do want to talk about additional webinars that our center will be engaged in the upcoming months. So on November 20th, we're going to have a webinar on psychological reactance and communication. How do we communicate to reduce psychological reactance from our audiences? On December 18th, we're going to have a webinar on reducing underage drinking with practical tools that develop social and emotional skills. January 16th, I'll be coming back to do a webinar on communication, which can be a catalyst for growing a positive culture. And on February 12th, we'll be doing a webinar called Moving Beyond Bystander Engagement, Growing Safety Citizenship to Improve Health and Safety. So I hope you take a look at our website and register for any of these webinars that we have coming up. And all of them, if you're unable to attend any of them, they will be recorded and placed on our website in the archive section. So do be sure to check that out. A couple of other resources from our center that I want to be sure that you know about are specific trainings. So I presented the Positive Culture Framework very, very quickly at the beginning of this webinar. But know that there is more information on our website. There's an overview webinar about this framework as well. But we certainly can provide trainings on that. We have multiple styles of training for that, or multiple lengths of training. We can, our standard training is 2.5 days, but we can also do a 1-day overview if your audience is interested in that. We have communication skills, and this specifically looks like social norms marketing. How do we clarify misperceptions in our communities or within our organizations? Leadership skills, so more in depth about what you learned today. Integration skills, how do we manage that portfolio of strategies that we're engaged in to improve health and safety? Another service that the center provides is called Guide Service. And this is part of my role as a research scientist at the center, where when folks understand the Positive Culture Framework and they're seeking to use the framework in their efforts, they can ask that a guide assist them in that effort, meaning that we walk with you as you implement this framework in your efforts in your community or within your organization. We provide assessments, surveys, lots of survey work on different topic areas, and evaluation work. And, of course, we have this free webinar series. So come take a look at our website, and we can and you can listen to any of these pre-recorded webinars. So with that, I'll turn it over and see if we have any questions out there. I'm going to look, and you can pose any questions in the question box of your kind of control bar there. I am going to, if I can, I'm going to unmute the participants. So in case you have any questions, you can ask. I've got everybody unmuted. Any questions that came up?
First, this is Lisa. This is Lisa Flaherty from Delaware. I'm a graduate student at GWU. I just wanted to say thank you so much.
And then I'll give you a phone call by the end of the day, okay?
Hey, Lisa, I'm sorry that I'm having a difficult time hearing you. Would you mind writing your question if you have one in the question box? I'm sorry about that.
Yeah, I'm actually I'm in the car, so I don't have access to that.
I can hear you now. Can you repeat the question?
I just wanted to say thank you so much. You had so much valuable information to share, and I think we underestimate the social ecology impact of us as a whole. And you really brought to light some things that have been on my mind, but I was unable to define what it was I was trying to define. And so thank you for that.
Oh, thank you for saying that. I agree with you. I think all too often we get so focused in on what we're doing with a particular audience and we forget about all that influence around them. Thank you.
And you had mentioned also that it would be in the archive section to review it. How long do you think would it take for it to be in the website?
It does not take long. I would anticipate, and Kelly, you can tell me if I'm wrong, but I would anticipate by the end of the week. Would that be accurate?
Do we get an email for the recording or archive? How does it work?
No, you will not get an email about it, but you can certainly check the website and you can tell there. Kelly, any insight on when that posting might be available to us?
Go here.
Yes. We haven't decided yet. Right here, I guess.
I'm sorry, I'm not hearing. I'm not hearing from Kelly, but yes, we can send out an email with a link to the website. We can certainly do that.
Okay. Also, then as an MPH student, they say that when we attend any webinars as a part of education, we should have some kind of confirmation that we attended the webinar. Do you send an email confirmation or anything that we can take to our advisor as a confirmation of our attendance?
Yeah, thanks for asking. We can send a certificate of completion to everyone after the webinar. So we'll take care of that. We have your email addresses, and we'll send out that certificate of completion. Absolutely.
Right.
Thank you.
Also about trainings that you mentioned, are these paid trainings or what kind of trainings are they?
No, they're in-person training, so we can come to your community or your organization and provide trainings. We also do provide one training a year that you can come to, so it's not to your community, but anybody from across the country can come to. And so we just had that actually in September in Savannah, but we will be hosting another one next fall, so that would be available for folks as well. And there's a lot of information on training on our website as well.
Okay, thank you.
And do you try to go to different parts of the country every year when you do that training?
We do, yes. We do try to go to different parts of the country so that we're not all on one coast or on the other coast, definitely, yes.
Okay. Is there any anticipation of where the next one would be for next fall?
Not quite yet. We are looking, when we take a look at places and start to narrow those down, we start to take a look at, is it an airport hub? Is it cost effective for people to come. So we are narrowing down between a few cities right now, trying not to maybe go to one of the coasts since we did that, but maybe in the middle of the country, but we're still taking a look at those cities right now. As soon as, and that will be announced fairly soon, like within the next month or so, I would suspect that we have that date and the location available.
Okay, well, wonderful. My goodness, what a plethora of information. Thank you so much. So valuable.
Thank you.
And hi, Catherine. My name is Chisara. I'm from New Rochelle in New York. I just wanted to add my voice to those who have thanked you already. I really appreciate you doing this. The webinar is so informative, and I'm happy that I'm able to attend.
Thank you so much. I appreciate that feedback. And I was in New Rochelle not too long ago, so thank you.
Oh, that's nice. You're very welcome.
So we will send you, I'm looking at some of the questions that are in the chat here. We will send you a link to the website. We'll also send out the certificates of attendance. And it was confirmed, yes, that by the end of the week, this recording will be up. So we'll be sure to point you in that direction as well. So I appreciate everybody's, oh, go ahead. Was there another question?
Oh, no, just wonderful. Thank you for getting back to me on when you would post that.
Absolutely. Thanks, everyone, for attending. And please know that on the website as well, you can connect with us as staff. So if there are remaining questions, you can certainly email me, and I can help answer those as well. Thanks,
wonderful.
everyone.
Thank you.
Hope you have a great day.
You too. Love to all you guys in Montana.
Thanks.
Bye-bye.
क्या कर रहे हो बेटा? Power.